This time, Dr. Michelle Oakley joins a crack team of scientists and woodsmen to collar a ferocious fugitive. And a visit with critters that bring a taste of the tropics to chilly Alberta.
Here, kitty.
Oh, jeez.
Then it's off to an island paradise, Alaska style,
This place is amazing.
where this isolated community's newest member needs a little trim.
You gonna tell Mommy you're okay?
And a trip to the dentist
Okie dokie, open wide.
becomes a surprise visit to the OR.
What the heck is that?
It's morning in the Yukon, and Dr. Oakley's packing for a work trip to Alberta.
Hey, where's that syringe at? My job keeps me on the road a lot because some of my patients can't just come by the clinic. I need to go to them. Can you give me a liquid, one of these guys? That's perfect, yeah, thank you. But I also have my patients here that need me, so I have to take care of them before I hit the road. Oops, she says, please call me right now. I just had a call from my friend Elodie. She has a 4-month-old puppy, and she's concerned that it ate a caterpillar. And caterpillars can be toxic, so we're gonna get to the bottom of this. Poisonous caterpillars. Yes, I know some are toxic. Which ones? Give me a list. How about some images? Ooh, they all look toxic, but are they toxic to dogs? This is a new one for me. I've heard of toxic caterpillars, but I'm pretty sure we don't have those in the Yukon. Oh my God, that one's cute. I'm interested to see what this is, because if it is a toxic caterpillar, that's new to the Yukon, and it could affect a lot more dogs. It's 8:45, isn't it? Yeah. Okay, well, we better bring her on in. Puppy time.
Whatever creepy crawlies this 4-month-old puppy has gotten into, Michelle will figure it
Who
out.
is this little lovely thing?
This is Birch. Birch bark.
Birch bark. You kind of look like a little bit of birch bark. Come on in to see me. So, what is going on with her?
Yeah, so she had a piddle and a little poo in the house, and then I told you the thing crawling, and I was like, oh my God.
Oh, okay, so you saw like a little parasite moving? Okay.
Well, yeah,
Like
and
a
I was like,
worm
did she eat a
mover?
caterpillar?
Okay.
That's what I was like,
Oh,
my God.
so
I gotta
did she
call
actually eat a
Michelle.
caterpillar?
I don't know.
Oh, but you just saw something that
I
looked
saw
like a
something crawling.
caterpillar in her poop.
Yeah, and I was like,
Okay,
okay.
no.
I'm like, no.
That's so funny. They do look like caterpillars, the big ones.
Yeah.
That solves that mystery fast. Elodie's never had a dog before, and so when she saw the parasite in the poop, she said she thought it was a caterpillar, not that it ate a caterpillar.
Yeah.
At least she's not gonna have butterflies in her stomach. That's what we know. But so the nice things about puppies, that they come with a little bonus. They come with worms, almost always.
Really?
Yeah, so even if the mom has been dewormed, there are some worms that can lie latent, and then when she has her puppy, she passes in the milk. For parasites, like 99% of them you don't even see, actually, but some of them you will see crawling along.
Well, this was big.
Yeah, so they can get roundworms that are quite big and tapeworms that are quite big. So, and, Birch, you've been handed over. You no kisses on the lips just yet, okay? Some of these parasites can be passed from the puppy to the owner. That's a good girl. It's okay. This looks like a tapeworm, and it's actually not the tapeworm adult that I'm concerned about. It's the eggs that are passed. It's very easy for a person then to accidentally ingest the eggs and then become the host for the tapeworm. So it's really important that you deworm these guys and get rid of them.
Sit.
I'll bet it's not gonna
Hey,
work. Hurry,
sit
hurry, eat it, quick. Oh, yes. Awesome. Thank you for coming in with your caterpillars and everything. That could be a new word for it. Does your dog have caterpillars?
Mock me. Go ahead, mock me.
Only because I know. You'll tease me right back, so.
I'll go put her in the truck.
All right. Thank you for coming in.
With Birch's caterpillars on the run, Michelle can finish packing for her big trip.
Come on, let's go.
She's off in search of a notorious northerner whose bite is just as bad as its bark.
Today I'm heading to the Birch Mountains area of northern Alberta. I'm actually out here to meet up with some folks from the Alberta Trappers Association and the Alberta Conservation Association. They've got a great project going here where they're learning more about the wolverine in the area, and so I'm coming out to learn a bit and help out. So, any wolverine around?
Yeah, we've had some pretty good action.
Oh, really?
Yeah.
3 and 2 days, I think? or
Oh
yeah.
my God.
Duncan Abercrombie is a trapper and woodsman who's an expert in catching wolverine. Allie is a wildlife researcher in the Yukon, here to assist Michelle. And Robert Anderson is a biologist with the Alberta Conservation Association.
I first started working with the trappers and the conservation folks that are running this project quite a few years back because they're going to be out here working, putting radio collars on wolverine. They came to me and asked for the proper training. This morning we got a really early call, got the message that there's a trap closed, so we're going to get on the road and head up there and just see what we got.
Yeah.
So I'll go get suited up. How long of a drive is it?
A couple hours.
Okay, I'll really get suited up.
Sounds good.
Wolverine are really interesting northern creatures. They're kind of like a weasel on steroids. I mean, they're just like really tough pound for pound, incredibly fierce, and very secretive and smart. There's been a few studies, but still, we just know so little about them, and they're really hard to study, track, and understand without a radio collar that's given you great information.
Michelle and the team hit the trail immediately. A captured female could have kits, and every minute she's away from them is one too many.
All right.
So let's figure out what we got and then
Okay.
go from there.
Okay.
Usually they give a pretty good growl
Okay.
right away, so we
Okay.
should.
There were, I saw there were both lynx and wolverine tracks on the trail.
Yeah, there was.
Don't hear any growling.
That's not a good sign.
You ready?
Yeah. Oh, well, you're beautiful, but you're not who we expected. False alarm, it's a lynx. These traps are set up to mainly only catch big things.
That's it there.
Oh, put it down. Yeah, it's, you know, kind of 50-50, wolverine or lynx. Wrong 50 today, we got the lynx.
You want to let me go?
Sure.
That didn't take long.
Turning stop.
It's over there.
Wait for the stop.
Oh, there he is. I can still see him going.
Hey guys, it looks like we're getting a signal from over at the House Creek trap.
Triggered?
Nice. So, but that could be a lynx, is likely a wolverine or what? Like what's
There's
usually?
Yeah.
Wolverine there and Lynx there.
Oh, really? Okay.
Yeah.
Yeah, so we've got one. I hope it's a wolverine. It's a good thing our gear's all ready to go. So we're gonna head out there and hopefully have a wolverine. All right, let's check it out. Oh, yeah. It's Wolverine. There is nothing that'll put the hair up on the back of your neck like the snarl of a wolverine. They have an unmistakable growl. You know, wolverine are about yay big, and that growl sounds about the size of a tiger.
I'm gonna lift this and then we're gonna look at it.
Oh yeah, he's here.
Yeah. Frick. Do you want to like lay everything out and then we'll have it all set ahead? Sounds good. Okay. So what we're doing is just laying out everything, make a nice warm spot insulated from the ground. It's about 26 below right now, so of course the cold's going to be a huge factor. So the insulating layer, we have tons of heat packs. Even our oxygen is heated here. Making sure everything's ready to go, because you don't want to be messing with it once you got her under anesthesia.
Okay.
Alrighty, let's start loading her.
Michelle draws up a cocktail of drugs to induce general anesthesia.
It's nice and warm.
The Wolverine has to be totally unconscious before they can even think about examining her.
There is no way to talk a wolverine into slipping a collar over their head unless you use some drugs so that they're kind of anesthetized or asleep. They really need to be out before you can get that collar on.
The drugs go onto the end of a pole, so the team can inject the Wolverine from a safe distance.
Do you guys want to prop the lid again and we'll keep this warm?
Yeah. Nice. All right. Getting the drugs into a wolverine in a trap is pretty tricky. She knows where we're coming from now. You know, they have a lot of space to run around. There's always the risk that they're going to come right back out at you. So when you open the lid, there has to be a little bit of coordination. Watch you guys distract a bit. It's definitely a team effort. Oh yeah, I got her. That was a solid hit.
Injection at 9:38.
That was a good one. Good hit. Okay, so now we just wait. We want to keep everything really quiet, really calm. A lot of loud movements, a lot of excitement is going to get the heart rate up on the Wolverine. It's going to get their adrenaline flowing, and that adrenaline competes with the drug. So it can take a lot longer to get them down if they're really excited.
8 minutes and 30 seconds.
So if she isn't down right away, we'll have to top her up. The longer we have her kind of out and dealing with these drugs, the more likely she's going to get hypothermic. And she could have kits in a den, and I don't want to slow her down from getting back to the kits. So I really hope she's down when I go check on her. Has it been 10 minutes?
Yeah.
This should do it. Check her out.
Why isn't she down?
I don't know. Check her out.
It's a frigid 25 below in Alberta's Birch Mountains, and Michelle and her team are having a little Wolverine trouble.
Why isn't she down?
I don't know. It was a really good jab. Oh. Let's just watch her for a minute. She's definitely feeling it though. Oh yeah. I think just all the riling up maybe. Yeah, so we'll top her up. Oh, it's cold. Top-ups are always tricky because if you don't give them enough on the top-up, you're chasing them. It'll just keep going. It'll keep going and going and going. But if you give them too much, of course, it all hits them at once like a ton of bricks. So this is definitely the art with the science in terms of finding the right top-up.
Plunger's up, a little froze.
Oh, is it? Okay. Plunger's frozen. Oh, good. Now I'm trying to get drugs loaded into the syringe, and they're basically freezing in the needle. Oh, there's ice in there. The joys of minus 25 in the field. It's kind of like every little thing doesn't work when you're down in the minus 20s and minus 30s. Oh, yeah. It's tough, but it's really her we're worried about. I mean, she also is gonna get chilled, and she has to get out of here even more than we do. Did you get her? Sounded good. So everybody away for 10 minutes.
The team leaves the Wolverine in peace while the drugs take effect.
All right, we're good. So the Wolverine's down, and now basically our clock has started. We've got 30 minutes to work on her. Vitals is actually the first thing. We've got to check it out, put on the collar, and we don't want to go too much longer because her temperature will drop. She'll start to wake up a bit as well. So we're gonna actually carry her over to a spot where we've laid out a down sleeping bag, a kind of a insulating layer underneath her, and we're gonna get started. So now let's get to work and get it done quick. First things first, we're gonna make sure she's stable in anesthesia, checking all her reflexes, checking jaw tone to make sure she's not gonna bite somebody. The first thing is to make sure that everybody else on the team is gonna be safe and the animal is safe to handle. Perfect. That takes guts, let me tell you. Oh, this is the stinky end. They're related to skunks, so. No, that can't be. Grab my thermometer over there. That cannot be. There's no way she's 36 degrees. I don't like that answer. I'll try again.
The normal body temperature of a Wolverine is 38 degrees Celsius, or 100.4 degrees Fahrenheit. But after the delayed effects of the drugs, she's dropped by more than 3 degrees Fahrenheit, which has Michelle worried.
So that time it stayed at 36.3.
36.3.
So we really have to keep her warm. Wolverine have a very high metabolism, which also means they tend to get hypothermic quite easily. So monitoring their body temperature and keeping them where they need to be during the anesthesia is critical.
You want to have a look at the neck then?
Yeah. The thing is we really have a certain animal we want to catch. There's a female out there who already had a radio collar on. They caught her about maybe 6 weeks ago, and they were a little concerned about some rubs on her neck from the collar, so they immediately took it off. But she's a really important animal actually to the study, so if this is the female, which we're pretty sure it is, that's perfect. Hopefully, if her neck looks okay, we can recollar her and we can continue the data with her.
What do you think?
She is the one that was collared before. The hair is nice, the skin is nice. It's totally healed up and beautiful. So I would be comfortable putting a collar on her. We should get her oxygen going too.
The thermometer's saying 35.9.
Okay, we should probably think about reversing her.
So that's definitely getting pretty cool.
Yep, we'll reverse her right after this. Do you want to pull up the reversal?
Yeah.
There's still more they can learn from this Wolverine. So Michelle continues the exam while Allie pulls up the reversal drugs.
So I'm gonna try and get a blood sample. It's really important to take these opportunities when you handle the individuals to get as much information as possible. But all that has to be prioritized because first things first, the animal has to be safe. We have to keep her warm and we only have a little bit of time to do that and make sure everything goes well. Yes. Like red gold, as long as I don't let it freeze until I get it in the tube.
With the collar and blood draw out of the way, the team checks her belly to confirm their suspicions about the litter of kits.
There's her teats. She's making milk and there's nothing in there, so she's got a litter.
Sweet.
That's awesome.
One of the things you have to think about with field anesthesia, especially when you're working on a nursing mom, is are the drugs going to affect the babies? And I chose these drugs specifically because they won't do that. So it's not something that's going to go into the milk that's going to affect the babies at all. You guys ready for reversal?
Yep.
Okay, reversal's going in. It's reverted.
Want to head to the front so we can look at it?
Yeah. And let's keep giving her oxygen, actually.
Okay, got the oxygen.
A few minutes, yeah. Ooh, it's nice and toasty in here. Oh, yeah. Okay.
So she's definitely starting to move her head now.
Yep.
Some big blinks.
I'm always so glad when it works. Close her up.
They seal their patient inside the trap so she can recover safely. After some peace, quiet, and time to respond to the reversal, she's starting to sound like herself again.
The growling's a good sign. Okay, let's let her go. I hope she doesn't run up my pant leg. Let her rip.
That's odd.
She's not sure where to go is the thing. Look at her. Her tail's up like a skunk, eh?
I was just thinking that.
I think we should get out of here. I think her den's here or something.
I think we should.
Yeah. Nice work, team. That went great. Yeah. Overall, today was super successful. We got the Wolverine we wanted. We put out the last collar that we had. We're going to be getting great information from her, and now she's going back where she belongs.
After collaring the elusive Wolverine, Michelle heads south to check up on some fierce predators you wouldn't expect to find in chilly Alberta. She's meeting up with Serena Boss, head zookeeper at Discovery Wildlife Park, a permanent home for wildlife orphans and illegal exotic pets that have been confiscated by authorities.
Good, here he comes.
Yep, here he's coming down.
Oh,
Mia,
geez.
Mia.
Oh, yeah.
Michelle is here to help Mia the jaguar with his arthritis. She'll be injecting platelet-rich plasma directly into his elbow joints.
So Mia is 15, and that is quite late in life for a jaguar. He's definitely in the geriatric stage. They don't tend to live that long in the wild. And because Mia was born in captivity with some skeletal deformities, he's had a lot of years of improper angles and impact on his joints. So he has severe arthritis and is really having difficulty getting around. Oh, Mia, you look sore. Yeah.
Good boy. Come let the vet see you.
Oh, buddy, those elbows. Mia's mobility has been so restricted that, I mean, the little ground squirrels outside the pen are coming in and stealing food from a jaguar. Like, that's not how it's supposed to happen. And he'd love to do something about it, but he just can't. So, you know, we know Mia's not feeling good, and we got to do something about that. All right, well, let's go get all our stuff ready.
And then as soon as you have the dart in him, we'll
Yep.
send him right back into his house.
Perfect. Okay, that's good. Serena's done lots of training with the jaguar, so we can do medical procedures.
All right, Meg, let's load up.
So she's trained them to jump up on a rock, so she's gonna lure Mia close to the fence. When Mia steps on the rock, gonna get him.
All right,
Release the cat.
Mia, come.
Oh, oh, buddy.
Good boy. Come on, your mark. Straight in.
Oh, sorry, Mia. Release the cat.
Mia, come.
Michelle is about to sedate Mia the jaguar for a procedure that could ease his arthritis symptoms.
Come on, your mark.
Oh, sorry, Mia. Wondering what's going on. Let's go.
Mia,
A
let's
little
load
bit
up.
squirted out.
Come on.
He's gonna be okay.
Come on, Mia.
I'm gonna stay here because he was looking at me kind of pissed off.
Mia, Mia.
Poor Lovey, look at him.
Good.
Getting the dart in was pretty easy. Serena has him very well trained. When the dart hit him, that was a bit of an unpleasant surprise for him. He got poked with a needle, and you know, the drugs are also a little stingy, so he jumped and reacted because of it. And you can see he's kind of like, wait, what just happened?
So he's
okay.
right here.
Immediately, she loaded him into his little back bedroom here. That's a nice, quiet, safe, dark spot, and then he's much more likely to get, you know, really deep in the anesthesia if he feels safe and everything's quiet. Can we show you in?
Nope, not right now. So can you see? I'll poke. Ready?
Yep. No reaction.
I see no reaction.
Awesome.
You want me to go in?
I'll go.
You're gonna go? Okay.
You got my back, I know.
I got your back.
Yeah. Hey, buddy. Hey, buddy.
So Mia had to be immobilized last year for a root canal, and the root canal went fine, but the several hours of anesthesia was very nerve-wracking for everyone.
1, 2, 3.
He had a lot of drops in blood pressure. He's a high anesthetic risk, but these procedures need to be done. So I'm very worried. We're gonna be all over his anesthesia and watching him like a hawk.
Nice and pink.
You ready to roll, Michelle?
Yep.
But our best way to kind of avoid any complication is to get it done quickly.
I think her heart rate's about 70-ish. I'll just hold his head. How about?
I'm gonna wrap it, yeah, because it's fluffy.
So today's procedure is not something I normally do. I'm here with a team of experts. Dr. Ravji is a stem cell researcher and physician, and his nurse Heather, and my technician Tony, and Dr. Archibald. We're all gonna work together as a team to make sure we give Mia the best possible care for this procedure.
It looks really good. He's really nice and pink. Heart rate's great. Resp is good. Temperature's awesome. 38.5 actually, which is good.
Okay.
Yeah, we're getting gas in there. Ooh, jaguar spit. Not something you normally want to have on you.
Michelle's tech Tony inserts a catheter into Mia's jugular vein for easy access to his blood.
Hey, nicely done. Perfect.
Okay, so if you want to draw, I'll just hold the head out of your way, Michelle.
Okay.
Michelle begins drawing the blood that will become platelet-rich plasma. But it's not a quick process.
The blood draw has to be really slow because if you pull it too fast, you can actually damage the cells or the platelets. And so you just don't want to get anything too stirred up in there. You want a really nice, clean blood draw with the cells not damaged.
5 cc's.
Rotate it a bit.
Yeah.
There we go.
We're almost there.
Okay. Okay.
We harvest the blood from the jugular vein of the animal, and we're going to actually insert that into a centrifuge, okay? Load it, which will spin the blood and actually separate the blood into 3 layers. Gentle on the plunge.
The platelet-rich plasma layer contains about 140 growth factors, which are natural substances that promote cell growth and healing, like fertilizer for your cells.
It's an automated system, so it will spin in 2 separate cycles for 14 minutes. It's decanting and separating some of the blood products so that we clear up and only concentrate the platelets.
What do you think, Dr. Sean? That's a big elbow.
It's a huge elbow.
I know.
Nice target.
Do you want me to start prepping this elbow shaving?
Yeah.
There's a lot going on right now, and we've got to keep getting everything ready to finish this procedure. Everyone's working as fast as they can. We've got the centrifuge spinning, but every minute counts. The longer he's under anesthesia, it's an issue. It makes me nervous.
Keep an eye on his respirations.
Michelle scrubs in while they wait for the centrifuge to finish.
I just had a breath.
But the waiting is taking its toll on Mia.
Tony, I'm getting like heaving in the tummy. See, we just did it again.
I'm gonna call off the scrub for a minute, sorry. Do you have dopamine pulled up?
Yeah.
Come on.
Is that something to be concerned about?
Yeah.
Keep an eye on his respiration.
Michelle is scrubbing in for Mia's platelet-rich plasma injection.
I just had a breath.
But before the PRP is even ready, Mia goes into distress.
Tony, I'm getting like heaving in the tummy. See, we just did it again.
We're prepping for the first joint injection, and Tony tells me that the blood pressure is dropping, and that's really serious.
I'm gonna call off the scrub for a minute, sorry.
Is that something to be concerned about?
Yeah.
When the blood pressure drops, you have a whole cascade of things going wrong. The blood is no longer being kept in the vessels. It can just lead to a complete spiral, shock, and death quite quickly.
It's slowed down a little bit now, but it's still doing it.
Do you have dopamine pulled up?
Yeah.
We have to get in there quick and reverse this, or before we even get started, we're gonna have to call the whole thing off.
Okay, our chest has settled now.
Start over. Just the blood pressure and heart rate were going down. It looked like the breathing was slowing down a tad bit too, so I want to make sure we don't get distracted and forget about the most important thing, how he's dealing with his vitals. Yeah, I mean, he's 15 years old, he's an older cat, he's had issues with the anesthesia before, so we know it's something to keep an eye on.
With Mia stabilized for now, Michelle suits up as the centrifuge completes its cycle.
Dr. Oakley, spin is complete, PRP
okay.
is loaded.
Great, okay.
We're not gonna operate this. We don't wanna cut the joint open. That would be really difficult for Mia, a really prolonged healing period. And we can get in a joint in a much less invasive way, and that's just with a needle and using an ultrasound to guide the needle there.
How are we gonna all fit in here? Squeeze in.
It's certainly tricky, but it's gonna be a lot easier on Mia.
Right there, okay.
That's perfect.
Okay,
Hold
yep.
that one.
Nobody move.
Skin, fat, muscle, bone, the joint, and you want to come in through there.
That looks like a rocky canyon.
There you
There you are, I see you, I see you.
Yeah.
To get into Mia's elbow joint is tricky.
Yep.
The elbow joint itself is kind of small. Mia's joint has had so much arthritis that it's got all kinds of little bony projections that are kind of growing around the edge of it. It's kind of like, you know, trying to weave our way in there through bony teeth.
Can I feel what that feels like?
Yeah.
Michelle takes the needle to try to find the sweet spot.
Oh, I just popped in, I think.
Yeah, okay, good.
Okay.
You're in the joint capsule.
Nice. I felt it just go thunk.
So, Heather, PRP. You can see it filling in.
It's like filling up a joint capsule right now. That looks so cool. Okay, one done, one to go.
We did it. We got in there, we got the injection in, which is awesome.
Poor buddy.
But the clock is ticking. We can't stop and celebrate. We need to get on to the next one.
Okay, here we go.
We need to roll him over to expose the other elbow and get at it.
And we'll see how this goes.
Dr. Archibald inserts the ultrasound needle into Mia's left elbow.
So do you see that needle coming in there? Awesome.
It's getting through the joint capsule.
Cool.
Heather, you got the PRP ready?
Crap, I kind of lost you there. Oh, there we go.
It's filling. Hang on.
Yeah.
Good?
Yeah, that looks good.
Okay.
Well done.
Beautiful.
Let that come out.
Excellent. Grab that ultrasound.
I want to give you a 5 first. Okay, I think we should probably start thinking about moving.
Okay, all right, the crate's ready when the cat is.
Okay.
Ready?
Okay. Got him. There you go.
So we don't know how jaguars will respond to joint injections. This is probably one of the first ones ever done, but it's still gonna be a long road of healing and physiotherapy. We're gonna be patient. Until I come back, fingers crossed, we're hoping for the best.
It's a new day, and as usual, Michelle is on her way to the edge of civilization. She's in the islands of Alaska's Panhandle, where traveling by wheelbarrow isn't as rough as it sounds.
This trail is amazing. I wish I could walk it like every day. I know.
Making the trek with her today is vet tech Tracy and Michelle's daughters, Sierra and Willow.
It's just a little further. We're going to the woods here. My name is Bob Clark, my wife and I. We came out here in 1975 and have our farm where we grow a lot of our own vegetables and raise our animals and eat our own fish and live the good life. Okay, we are here.
Whoa, this is amazing. Game Creek Farm is right on the ocean.
There's a whale blowing out there in the water.
There is. I can see it. I can see it floating out there. It's a little bit tricky to get to. It's so far off the beaten path, but getting out here is part of the adventure. It's literally a little slice of heaven out here, and the animals just thrive here. They have cattle, they have horses, there's dogs, there's kids running around, there's grizzly bears out grazing sometimes, so who knows what's gonna come at me today. So who's in the barn again?
Baby bull calf that's about a week old.
Oh, okay.
So we'd like to castrate him.
Sure, no problem.
And we've also got 3 horses that we'd like to float to teeth.
Oh,
there
okay.
again, if they're going to
Okay.
cooperate and come in. Very good.
All right, let's get started.
Let's go look at the calf here.
The bull calf is in a stall with his mother, Petunia, one of the farm's trustiest cows, and a protective mom.
He looks pretty big already.
Yeah, he's growing every day.
Oh, yeah.
Okay, be sure to keep this real close now with the mama.
Okay.
I'll try to get him out here. As long as mama doesn't come out of the stall, we're okay.
Okay. Is that a possibility?
She's going to be a little noisy, I have to
Okay.
tell you right now. She doesn't like being away from her calf.
Oh, okay.
Come here, little guy.
She looks a little nervous. It's okay, Mama.
Okay, that's it. Yeah, okay.
She's like, what are you doing? Oh, heads up. She's trying to come too.
Petunia, you stay out.
Nope. Nope.
You stay out. Stay out. Just hang on to him. Okay, give her some green in there now. Come on, little guy.
They distract Petunia with tasty grain, but will it be enough?
Okay, let's go. Okay, he seems to be cooperating really good. Hang on to that bridle.
So Bob's fashioned a really nice squeeze where we can just get the calf in there, get him squeezed up.
Walk right in there with him, that's it.
And just with the sedation at a local, I can do the standing pretty easily.
Come on.
The calf is being castrated, so he won't compete with their breeder bull.
Got him.
Okay, awesome. Let me give him this little sedation.
Okay.
Bob.
There's mama. She's the... Yeah, give the mama some grain, a little hay.
He's looking pretty good. Okay, I'm gonna go ahead and give him his local.
Michelle injects the target area with lidocaine to make sure the calf's surgery is painless.
Perfect. Good boy. You barely even noticed that. That's nice.
But Petunia can't understand what good hands her baby is in.
Uh-oh. Oops, she's trying to get out. I don't want her barreling through here. He's looking pretty good. Okay, I'm gonna go ahead and give him his local.
Michelle is preparing to castrate a week-old bull calf, but his doting mother is just down the hall, and she has a mind to rescue him.
Uh-oh. Okay, we're going quick. I hear ya. Oops, she's trying to get out.
You hold her back in there.
I don't want her barreling through here. So the calf's behaving himself just fine, but Mama is not happy. She's calling to him. She doesn't like that they're separated. She's pushing on the gate. I'm a little worried she's gonna break out and just try and come and run us all away from her calf. Luckily, she can't quite push her way out of the gate. So I'm just gonna keep going and hope she doesn't figure it out. Oh, is he going down?
I think so. Well, he's awful relaxed.
You gonna lay down, buddy? You can. You can lay down.
Being a little sleepy.
Could we help you with that?
Yeah.
How about that?
There we go. Now this part next, go on. Oh.
I don't think he'll lay down.
How about we just hold him, Sierra, at his shoulders? We'll create our own human stand.
Or just hold him up?
Yeah, we'll just
sure,
hold him
that's
in
fine.
place.
Okay.
Okie dokie, bud. We need to scrub him a little bit. Scrub-a-dub-dub. Sorry, it's kind of cold water. I don't want to lose him. We need those to stay hanging down.
Well, he's very cooperative so far.
He's being awesome. Uh-oh. I don't know if Mama's being as patient.
Yeah, go down there and be with Mom a little bit, boys. Give her a little more grain, just a little bit at a time.
Okay, is everybody hold him tight?
Okay.
Take the end off the scrotum here. There they are. So I just took the bottom of the scrotum off, as you can see. And so I'm just gonna, he's kind of too small for my emasculator, so I'm actually just gonna tie these off real quick and keep it clean.
Well, he's not feeling any pain,
No,
so you gave
that's
him
the nice thing is, you know, a little bit of
Yeah.
a block, a little bit of sedation,
Right.
and they don't cry at all.
I think he's dropping.
Oh.
You want to just lay him over?
Yeah, if you guys want to put him on this side.
Lay him down, lay him down.
Yeah, that's actually
definitely
easier for me. I can see what I'm doing. Cut that.
Not bleeding.
No,
Nice.
So that one's good. Next.
he's in good hands.
So far it's going great. I've got my helpers. Bob brought his. There's a lot of kids and a lot of folks here eager to help, and we're getting it done. Okay, he's good. It's really easy when you have so many people who know what they're doing and want to help and get it done quickly. Hey, buddy, all done. Those off, and we'll just make sure that's not bleeding. And
When they're over there, you know there's no chance.
yeah, you know it was done.
You know it was done.
Okay.
Good job.
We're gonna make sure we keep these. We don't want the dog getting those because they're full of lidocaine, which could make him sick, so. Or at least make his mouth numb. Okay, he's ready to get up.
Oh, yeah. He's ready.
There you go. He's ready to
Steady
go
on
back
your
to
feet,
Mama.
buddy.
That was good timing, huh?
Steady on your feet. That was perfect timing.
Your tongue. You gonna put that back in? So it takes a little while for the sedation to wear off. Okay, start staggering. So we're gonna leave the baby calf in with the mama.
New dance step.
You're almost there, look. It's okay. Oh my goodness, he's coming. And once he looks like he's moving around better, we'll open the gate and let them into the field. There you
Get a nose in
go.
there. There we go.
Okay.
Good. Well, Michelle, this is rolling right along. Yeah, we've got a lot of other animals to look at. And
Sure. Lot to do today.
we'll all load it up in the truck and see if we can find some animals.
Okay. So we're done with the cows, onto the horses, and we're not too sure where they are. They're somewhere out in the field, so we're just gonna take the office to them and do it out there. Alrighty. Oh, it's so beautiful. This spot is the best office ever. I mean, it basically is the definition of idyllic. It's this huge field, gorgeous mountains in the background. So I'm very happy that this is my office today. Alrighty. Looks like they're coming in now.
We got the 3 horses.
Okay.
Norwegian Chevrolet, no, Fjords. Fjords.
Norwegian fjords were war horses for the Vikings. Their thick coats are well suited for brutal Alaskan winters.
We're going to try to float the teeth in all 3 of them.
Okay. And when's the last time they had that done, do you know?
Well, it's been quite a few years.
Oh, okay. Hello, Stormy. How are ya? You're a mellow thing, aren't ya? You just stand by with her, and then we'll get her sedation going. Because of the chewing action of the horse's teeth, when they're chewing, they basically kind of rub them off so that there's points on one side and points on the other side. Okay. So those pokey points will actually pinch their gums, they'll start to wear away at their tongue, and it becomes really painful to eat. And then they'll start dropping feed, and it becomes a problem. So I'm gonna come along and file those off so the teeth meet nicely. You are not bad for an old girl who hasn't had it done for a while. Okay, one down. You know, horses in the wild don't live near as long as horses in captivity because we do all these things like help with their feet, help with their teeth. Alrighty, and hoist them up a bit. That's the unfortunate thing is the horses that are feral or, you know, no one looking after them like that. And they die of tooth problems.
Pretty easygoing animals, aren't they? These
yeah.
Fjords.
Okay, that's it for him.
Number 3.
Number 3, that was pretty easy peasy.
Great. Didn't take much time at all.
Perfecto, good boy. Okay, what else you got for me?
Well, we got to walk these horses around, make sure they're going to recover good.
Sierra, do you want to lead that one around? He might not be ready to go anywhere yet, but when he's ready, you can walk him.
Sierra takes charge of Knickers, but she notices something on his right side that has her concerned.
Mom, is a sarcoid just like filled with pus, or is it a little tumor?
It's a tumor.
It's a little growth?
Yeah, it's like a little growth, yeah. Why, do you see something?
Yeah.
He might not be ready to go anywhere yet, but when he's ready, you can walk him.
Sierra is helping Knickers the horse walk off his sedative when she notices something odd on his right side.
Mom, is a sarcoid just like filled with pus, or is it a little tumor?
It's a tumor.
It's a little growth?
Yeah, it's like a little growth, yeah. Why, do you see something?
Yeah.
So just as I finished floating the teeth, Sierra said, oh, did you notice this little growth here? And as we moved the fur back, it actually was pretty sizable and kind of a firm, dark mass. So that is definitely something that we better to remove than just to leave there. Depending on the type of mass, those things can get away from you quick. So we're gonna go ahead and remove it. I'm just gonna do the local first. Okay. Hello, I know. What the heck was that, huh? Okie dokie, so give him a local. Just gonna pop some of the hair off around it.
A sarcoid tumor is usually benign, but not always. It's been linked to bovine papillomavirus, or BPV, a close relative of HPV, the virus that can cause cervical cancer in humans.
We're glad you discovered it, Sierra.
So am I. That would have been uncomfortable later, hey?
There we go, just like an extra nipple he doesn't need. A little moob. Nobody needs that in that spot. We're gonna remove this right now.
Oh.
Oh, snap. There we go, a little scrubby dub. All right, let's see how well my block worked. Okay, you ready, Sierra? Hold them tight. If this is a sarcoid, which it looks like it, it's hard to tell for sure. It's good to get them while they're small and easy to get at and easy to remove. I'm guessing that block worked then. Yeah, so I'm just doing a bit of an oval shape. I'm trying to get a little bit of a margin going on it for sure. Sarcoids can become really nasty. They can spread, they can get big. It's also right where you'd have a saddle, so that's definitely gonna become ulcerated and become a problem later if they start riding them more. Tough and fibrous. There it is. It's a tumor. And you can see the back of it. Doesn't look like it's invasive or much going on. It looks really nicely encased. Problem solved. Get to closing. How are you doing? Hold on, buddy. Okay, we're almost done. I just want to loosen this up a bit so it'll close and stay closed. Alrighty.
Nicker's sedation is pretty well wearing off.
He's getting a little alert now. See, his eyes are perking up.
As I'm finishing the last few sutures and closing up the defect, he's starting to become more aware. His ears are turned back. He's listening to me. He can kind of just barely see me in his periphery, and he's just like, okay, I don't know what you're doing, but all right, whatever. Pretty chill horse.
Okay, that's it. All done. Yep.
Wow, good.
Yeah, it went great. Good eye, Sierra. You're always finding work for me.
Okay, kids, go take the halters off the other horses.
Nicker's uninvited guest got the boot, and all 3 horses are back out to pasture, which is where Petunia and her recovering calf need to be.
Come on, Mama.
There you go.
Let's go.
Everybody out.
Come on.
It's been a couple hours. We let them out, and he doesn't even know anything's missing.
Oh my God, look
at! He's kind of bucking and ripping around, and he looks great. Woo!
Oh my God! Oh my God, look at him. What a stinker.
This was a fantastic day. We got a lot done. We enjoyed the scenery. It did not feel like work, even though we did a lot of work. And it's always great to be out here hanging out with Bob and the crew.
Mia the Jaguar has recovered from his platelet-rich plasma injections. And Serena can't wait to show Michelle and Dr. Ravji how he's doing with his physiotherapy.
Let's come around to the front. I'm just gonna grab my training stuff. My crew will get everything in place, and we will bring the Jaguar out.
Okay, release the Jaguar.
I'm really hoping to see some improvement, some increased interest by Mia.
Go ahead.
That he wants to move around more, that he will jump up on posts like he used to. I mean, if we just got 10% or 20% improvement in his mobility, that would be a huge improvement.
Oh, wow,
There
that's
you go.
excellent.
That was awesome. Oh, look at him
Wow,
jump
look at
into
him
the...
jump.
That's
incredible.
Awesome. Mia, you're doing
boy.
more
Oh.
stuff.
All right, come here, handsome.
He doesn't
Oh,
seem to be
Mia.
hindered at
I
all
know.
from coming down.
I am blown away by both Mia's progress and improvement and actually the potential here. There's a lot of older animals in captivity and they need care for arthritis. It's very common. And this kind of just has opened my mind to there's stuff we can do. And it shows we all have to keep improving our medicine. We all have to keep working together to find ways to keep these animals happy.